Hello, thank you for joining me for this PowerPoint presentation. I'm Emily Schranz, a registered nurse, and I'm here to talk about a topic that many are not comfortable talking about, or that many don't realize is something that is needed to be talked about: the impaired professional, or addiction in nursing. Awareness and knowledge are the key factors to success when encountering this disease. 4 areas that I will focus on are self-awareness, awareness of others, what to do if you are abusing drugs and/or alcohol, and what to do if you suspect a coworker is abusing drugs and/or alcohol. Step 1, self-awareness. The biases, the "this will never be me's." No one grows up expecting to be an addict. The most important thing we can do is to be aware of our own risk factors, our own history, and to be aware of addiction in general. As you can see from this slide, about 10 to 15% of nurses will suffer from addiction, and a reported 3 to 6% are in active addiction at any one time, with prescription drugs being the primary drug of choice in this population. ER and psych nurses have the highest known rates. They're fast-paced, easy access to the types of substances that are abused. Anesthesiologists and nurse anesthetists, their rates are greater than 15%. In the general population, only about 14% of addicts and alcoholics will electively seek treatment. With nurses, they're less likely to electively seek treatment due to fear of job loss, losing their license, and the negative stigma from coworkers and family. Prior to mandatory reporting, less than 1% of all actively licensed nurses were sanctioned each year. Some general risk factors for addiction. We have psychological factors of depression, anxiety, low self-esteem, feelings of resentment or needing to be perfect. Behavioral factors include using other substances, avoiding responsibilities, impulsivity, alienation, rebelling. Social factors, being around others that condone the use of alcohol or drugs, thinking that the use of these is positive, and availability of drugs and alcohol. Demographic factors, we have the male gender is at an increased risk, inner city or rural upbringing. Family factors, if your family uses alcohol or drugs, if you have a lack of positive family rituals, poor parenting, or family trauma. And then genetic. It is an inherited genetic condition. And then there's some unique risk factors for nurses in the workplace. Role strain, being overworked, being tired, too many patients, feeling insignificant at work. Enabling by peers or managers, if they overlook symptoms due to their fear of their coworker losing their job. Different attitudes towards drugs and drugs use. Drugs promote healing. That's what we're taught as professionals. The lack of fear that they will cause harm or that they will become addicted. Availability of narcotics and abused medications, and then physicians being willing to prescribe to their nurse friends or their physician friends when they have complaints of pain or fatigue or unable to be able to sleep at night. So what do we see when we think of an addict? Here we have a slide with many different pictures of many different people. And looking at this, is there any way to tell which one of these people might be suffering from addiction? And the answer is no. All of these people could be suffering from addiction or could not be suffering from addiction. And then here is a collage of many different famous people that we all know. Can we tell which of these celebrities are recovering from addiction? The answer is every single one of them. And there's a lot up there that I was surprised by. To be effective, we all need to be aware of our own biases. Who do we see when we think of an addict? I met many people in my experience with addicts that never in a million years would I have previously thought was an addict. Addiction is a disease that does not discriminate, from the most affluent to the poorest, from the more respected to the least responsible, from the managers to the janitors. There are no boundaries for addiction. Point 2. Awareness of others. Things to be aware of. Ways to identify the impaired professional in the workplace. It's hard to tell the difference between stress-related behaviors and impairment. However, you have a vital role in helping to identify nurses with a substance use disorder. Nurses that educate themselves about the behavior changes, physical signs, and signals of drug diversion will help not only their colleagues with substance use disorder, but also help protect patients. Many nurses with substance use disorders aren't identified rapidly. The cues are misread, ignored, and other explanations for suspicious behaviors are given and believed. 3 different categories for signs of an impaired coworker. They'll have behavioral changes, physical changes, and there will be signs or red flags of diversion. And diversion is a fancy term for stealing medications from work. Some behavioral changes that you can notice: changes or shifts in their job performance, absences from the unit for extended periods or frequent absences, going to the bathroom often, arriving to work late or leaving early, or even sometimes arriving early, making lots of mistakes, including med errors, if they're defensive, if they deny that they have a problem, or if they're using gum mints or mouthwash excessively, and if they're missing work often. Some physical changes that might be noticed: if their speech is slurred or they're not coordinated, some small changes in appearance that may escalate over time, wearing long sleeves in warm weather, if they increasingly isolate from their colleagues, inappropriate verbal or emotional responses, or if they're irritable, if they have diminished alertness, confusion, or memory lapses, and if their charting is sloppy or illegible. And then we've got some red flags of diversion: incorrect wastes, incorrect counts, if someone's frequently wasting narcotics throughout their shift, if their patients are not getting effective pain relief after being medicated, if someone's offering to medicate your patients for you, if they're taking medications out on a patient they're not taking care of, if they're volunteering to take care of patients that take a lot of pain medications, if they're on the unit when they're off, if they're in areas that they're not assigned to, if they're accessing Pyxis or Omnicells in areas where they're not assigned to, if there's a dose taken out but it's not documented. And I'll just let you read over those for a second. Step 3, what to do if you are abusing drugs and/or alcohol. If you ever do find yourself questioning whether you are abusing drugs and/or alcohol, or if you start to relate to anything you hear today, The most important thing to remember is that there is hope, there is help, there is another solution. Many hospitals, if a nurse does admit to needing help, will assist the nurse find the help he or she needs, give them a leave of absence to get the necessary help, and then let them return to work, either in the same job or in a job that is more appropriate for someone in recovery. So seek help and know that there is hope. And then we move on to what to do if you suspect others are abusing drugs and/or alcohol. Mandatory reporting came into effect on July 1st, 2014. It states any nurse is required to report the name of any nurse if there is reasonable cause to believe that the other nurse has violated any of the grounds for discipline provided in the Nurse Practice Act, which includes addiction, diversion. Also, any employer of nurses is required to report the name of any nurse whose employment has been terminated or who has resigned in order to avoid termination for any reasons provided in the Nurse Practice Act. Prior to mandatory reporting, a nurse could violate the Nurse Practice Act, be terminated, and seek employment elsewhere. It was not necessary that that nurse be reported. So they could be fired and just go find another job without the employer following up to make sure that this nurse got the help they needed and that their patients were safe. So you have a professional and ethical responsibility to report a colleague's suspected drug use to your nurse manager or supervisor. So any suspicious activity should be reported and followed up on. The Board of Nursing has an Impaired Professional program. Prior to the 1980s, nurses were immediately fired from their position and disciplined by the Board of Nursing. Now there's a strong trend toward non-disciplinary programs that focus on rapid rehabilitation and treatment, removal of the nurse from providing care until their safety to practice has been established. Georgia was the first state in the nation to acknowledge the need to treat, support, and retain impaired nurses. Now 43 states, the District of Columbia, and the Virgin Islands have programs to channel nurses with substance use disorders into treatment and recovery programs, monitor their return to work, and prevent their license from being revoked or suspended. These are the main points I want you all to remember throughout your nursing careers. While 10% of all nurses will suffer from addiction at some point, the other 90% will likely have contact with or work with an impaired nurse. It is very unlikely that a nurse would self-report using drugs or diverting. They are scared of losing their jobs, scared of losing their license, scared of losing their reputation and friendships. If it's a coworker that you don't know very well, document the facts, the signs you've observed, the documentation errors you've noticed, tell a supervisor, and follow up. If it's a close coworker or friend, talk to them. Tell them what you've noticed. Ask if they are using drugs and/or alcohol frequently. If they do admit to abusing drugs and/or alcohol, tell them you can help them. Walk with them to the Employee Assistance Program or sit with them while they call. If there is no EAP, help them call a treatment center with a professionals program for direction and options. Again, follow up to make sure they are getting the help and monitoring they need and that they have reported to the Board of Nursing. Remember, mandatory reporting became effective in the state of Georgia on July 1st, 2014. If they deny using drugs and/or alcohol frequently, and if they get defensive, this is a red flag. Genuine concern for someone should never result in anger. You need to pass this information on to a supervisor. By intervening, you do risk having your friend and coworker be angry at you. That anger will only be temporary. No one suffering from addiction wants to be. They don't know a way out. They don't know that there is a solution. They do need help, whether willingly or unwillingly, to take that first step towards recovery. Next, you will hear one nurse's true experience with addiction.